I'm sorry.
You're the med student, are you?
Yes. Hi, I'm Emory.
Murphy. You can borrow a pair of mine today.
Thanks.
This is your first rotation, right? You'll love surgery. At the end of the day, you might want to jump out a window, but it sure is fun.
Wait, jumping out of a window is fun?
Surgery is fun. Oh, so that's our attending and first patient. You're going to want to go introduce yourself. I'm going to go finish up some floor work, but you're going to want to get on Perry's good side because he's the only one who fills out your evaluations for the next 4 weeks.
Okay, thanks.
Good, are you the new nursing student? Okay, can you go find my resident? She should have had this consent filled out by now. And while you're going, ask the nurse to bring us another blanket.
Yes, sir.
So, all the student nurses get a little nervous when you don't worry. The real nurse is good though.
Okay. You know, my kids didn't want me to have this surgery. They said, Charlie, at 95 years old, you're too old for this sort of thing. Can you believe that my kids call me Charlie?
Not surprised, kids have no respect these days. How old are they now?
My daughter's 65. And my son must be 70, I guess.
Yeah, okay. You know, that's great, that's great. So, I'll see you in the OR. Anesthesia will be by to get you ready. And my resident will be back with the consent for you to sign for the surgery. It's just all that stuff we talked about in the office last week.
Okay.
Okay, sounds good?
Yeah, that does
Okay,
sound
great.
good. Oh, but wait, actually, I wanted to ask you.
Okay, so you introduced yourself to the patient?
Yeah, I think so, yeah.
You did or you didn't?
I did, yes.
Okay, great. I'm going to need you to get this consent form filled out, and then I'll meet you in the OR, and I'll help you get scrubbed in and all that stuff. It's in AAA repair. It should be pretty interesting.
AAA, abdominal aortic aneurysm repair, right?
Yeah.
Isn't she a little old for that? She's like 95, right?
The woman wanted the surgery, and Perry's good. Ambitious maybe, but really good. If anyone can do it, you can.
But isn't it dangerous to operate on someone? I mean, she's that old.
Yeah, she's a little old. You know what? I'm gonna come do this with you. I should make sure everything's you can come listen in, but I should make sure everything's explained properly.
So that's my resident, and she doesn't even introduce me to the patient because she thinks that I already did that.
Yep.
I didn't have the courage to correct the attending when he called me a nursing student. And now it just seems too late. I didn't really get a chance to even ask her permission. Do I need her permission? Either way, the patient gets consented, and suddenly we're headed straight back to the OR. Did you know, in the operating room, that patients are buck naked when we get them on the operating room table? I had no idea. I tried not to stare, but it's hard to be modest when everything is just flapping around so efficiently. Then the sterile sheets cover everything, and I can't even see her face. This human being has been reduced to just a surgical field. Skin and flesh that splits back so easily behind the blade of the knife. We head to the operating room, we wash our hands, the rituals begin. And as we approach the patient, the attendant, he hands me the knife, lets me make the first incision. Just a shallow skin cut, But the patient doesn't know that a medical student's doing this. And I feel guilty for the thrill I feel when I hold the knife. I wouldn't want a medical student cutting my body.
Med student, come here and retract this properly for me. There you go. Don't be scared. Really put your back into it. I'm trying to get a good view. So, Murphy tells me you're interested in surgery.
Yeah. Maybe general surgery or like a subspecialty or plastics, ophtho. Yeah.
Okay. That's great. I give all my students A's who are interested in surgery. It shows they're into the right stuff. The others, not so much, but you seem like a smart kid.
Thanks.
Murphy, watch it. Learn how to handle the bovie like a real surgeon, for God's sake. How do you even imagine the surgery? Should have picked psychiatry.
Sorry, boss, it's a difficult angle.
You should be able to work from any angle. So, are your parents in medicine too?
No. Dad's a librarian and mom's an accountant.
They must be really proud then.
Yeah. Did you hear the one about how many psychiatrists it takes to change a light bulb?
No, this is gonna be good. How many?
Just one. But the light bulb has to really want to change.
You know, I like that. I like that. You'll make a great surgeon. You taking notes, Murph? Murphy, what did I tell you about elbows in the surgical field? And where are you going with this stitch? Did you even review the surgery before you just waltzed in here?
I didn't waltz.
What?
I said, I'm working on it, boss.
You know what? No, you're done working on it. Hold this retractor.
And that's most of my education. You get surgeons like Perry, and then they wonder how residents reach their 4th year without knowing how to do an appendectomy. Now watch this, as he leaves the suite before any of the deep layers are sutured.
Ooh. Oh. Kobe.
I'm a 2nd year, and he's not even in the room. For the uninteresting stuff, now I'm useful again. But who's going to tell? Not the med student, who at least realized quickly that her grade depended on being interested in surgery and nothing else. Not the scrub tech, who's worked with Perry longer than I've been alive. Somebody told me that they might have had sex earlier, but I don't know if I believe it. The circulating nurse is afraid she's going to get fired, and the anesthesiologist is playing a game on his phone. And me? All those other surgeons would hate me if I snitch, and anyway, I suture the rest up nicely myself. Nothing goes wrong. I even help the med student suture at skin level, get a little teaching time in. Even though the anesthesiologist wants to hurry the case up. Well, he lost his game of Candy Crush. Hey, Miss Charlie. So we finished the AAA repair a few hours ago. Everything went well. How are you feeling?
Oh, I hope Dr. Perry didn't actually let you operate on me.
Oh, I'm sorry,
You could have told me there'd be all this pain.
I'm sorry to hear that. We'll have to see if we can increase your pain medications a little bit.
Oh, now you want to make an opiate addict out of me, too.
No, Miss Charlie, I can assure you
Miss
that we're...
Charlie, good to see you, good to see you. So, the surgery went well. I'm really happy with it, and you should be good to in no time.
Thank you. I feel great, too. Just a little bit of pain. And to be honest, I don't like your resident much.
It's okay, she takes some getting used to.
Women just didn't become surgeons back in my day.
You know what, don't worry. I didn't actually let her do any surgery. She did a really good job retracting them.
She won't give me anything for the pain, though.
Okay, here's what I'll do. I'll write an order for a higher dose of morphine, and don't be afraid to use it. Medicine is here so we don't have to suffer, and you just went through a pretty big operation. Okay?
Thank you. It's not that I don't like the young resident. I do. She reminds me of my daughter. That same determination. But I've been alive long enough to know that you have to be vocal, and maybe even a little bit rude to get what you want in the hospital. My husband died in a place like this, from cancer, and I didn't like his residents. Half the time, they forgot about him. They didn't listen. That's what happens if you're not careful in the hospital. They forget about you. You have to talk to the person in charge, the attending doctor. He'll do things right. I trust him. I just wish I'd known how careful you have to be when it's an ugly thing, dying.
Okay, shoot.
Okay, so Miss Charlie is our 95-year-old woman who's post-op day 5 from a AAA repair. And last night she spiked a fever to...
Okay, that's great. All right, I already looked at the labs. Your physical exam probably sucked. So skip ahead to the assessment and plan.
We should get antibiotics and blood
Wait, you went
cultures.
straight to the plan. What's the assessment? What do you think is going on?
She's
Weak. What are the 5 W's of post-op fever?
wind, water.
That's 2. Come on, Oaks. This is pretty basic stuff.
It's Oakley.
Wind, water, wound, walking, wonder. Do you even study? You know you have a shelf at the end of this rotation. You're lucky Perry's not here.
I'm sorry. I just came off of studying for step 1, okay? I know all of that stuff. Ask me what agar to grow Legionella in. Or which fungi are dimorphic. That's the stuff I know.
No one cares about that stuff. You're on wards now. Keep up. Hey, Mrs. Charlie. How you doing? What's going on? How you feeling?
Go away. I want to see a real doctor. Whatever this is your fault.
Well, I'm sorry to hear that, Mrs. Charlie, that you're feeling so poorly. I can assure you we're taking the best care of you as we can. Dr. Perry will be by later this afternoon, but in the meantime, I'm going to figure out what's causing you this fever. Can you tell me what's going on?
That's supposed to be your job.
I mean, how are you feeling? Are you in any pain?
I asked her this morning and she said
I said go away.
Okay, Miss Charlie. Well, I'm going to do a quick physical exam and then I'll stop poking you, I promise. All right. Okay. So that wasn't a great physical exam. Do not take that as a model. But I'm worried about her. She doesn't look good. Can you tell me what you found on your physical exam?
I didn't do one, actually.
Why not?
Well, you never want to hear my physical exam on rounds anyway.
That doesn't mean you shouldn't do one.
I don't know, it's just, she was really upset when I came by for pre-rounds too.
Was she
so I
rude
was
to you?
really-
To me, it's one thing, but I won't have her.
No,
come
no,
next.
no, it's not just that. She just seemed to be in such pain. I didn't want to bother her.
That's it? Oh, because you can't let your fear and her bad personality prevent you from doing your job.
I mean, you just did.
So I realize I'm not grading you, but boundaries, Oaks. Boundaries. Remember where you stand on the totem pole? Anyway, we can probably figure this thing out with labs. She probably has an infection. I mean, have you seen Perry at the scrub sinks? Great guy, love him, but sometimes anyway, so. Anyway, we have 30 other patients before our first case. Do you know how sleep deprived I am?
Yeah, I've seen your notes.
What?
Nothing.
Okay. I guess we'll just order some antibiotics and blood cultures, and then we'll swing by Perry after our last case if he doesn't do a Houdini.
Charlie's dead. She died before I could see her this afternoon. The resident should have told me it was serious, but I think I know why she didn't. And the cause of death, it wasn't the surgery. Of course it wasn't the surgery. I did the surgery. It was a pulmonary embolism and no one recognized it. Her leg was swollen with the DVT and no one noticed. Her compression boots were on, but they weren't working. Believe that. The administration isn't happy. Just got out of a meeting with them. They like me. Of course they like me. I'm their best surgeon. So there was some heavy implication that my resident was at fault. But you know, I told them no. I told them Murphy was my resident, so her faults are my faults. She's a good resident, and this was just a mistake. I'm gonna take a week, meet with the lawyers, go through the paperwork, meet with the family, convince them not to sue. But you know what? Her kids, they're older than I am, and they're finally coming into their inheritance. They should actually be thanking me. I think I'll take some time to spend with my family too. I've been going at this too long. I feel like I'm drifting at this point. But you know, it's just one patient. You know, patients die all the time, right? Like, what does it even matter? What does it even matter? You know what? No, I don't want to hear your excuses. Do you understand? Your laziness and your incompetence killed the patient.
Yes, sir.
No, did I ask you to speak? You know what? I'm assigning you to a different surgeon. I don't even want to see you in my OR.
Yes, sir.
So, should I still send him an eval?
Probably not.
Is he allowed to even do that? Just like kick you out of the OR for the rest of the week? Shouldn't you two like debrief or something and discuss what happened?
I'm sure it'll come up in an M&M. Another chance for them all to yell at me. No, he's not taking a leave of absence. Word has it they're kicking him out of the OR for a whole week. They said somebody tried to, they asked him to throw me under the bus and he wouldn't do it.
What? Why would he defend you like that? He doesn't even like you. He like, despises you.
Mold in the cold, yeast in the heat.
What?
I thought you said you knew basic science. We're like fungi, we're all dimorphic. We all have two sides.
Two sides? He's just an asshole. And we're not fungi.
And you were gonna send him eval. Nah, Perry's all right. He's a bad surgeon, but a good person. Well, except sometimes he's a good surgeon and a bad person.
You're like contradicting yourself there.
It's how I justify things.
Look, I'm just trying to get through this rotation. I don't even want to go into surgery.
You think the rest of medicine is any different?
Yeah? It might be, right? It could be.
If you're not careful, the sleeplessness and the guilt will chew you up.
Do you feel guilty?
About Charlie? Nah, she was old. Way too old for that kind of surgery. Perry shouldn't have done it. I don't feel guilty. It's not my fault.
But you did miss the swollen leg on physical exam. I mean, look, I don't mean to imply that, like,
It's fine.
you were, no, it's like, you're a good resident.
I said forget it. It's fine.
It's just, this is really upsetting. I don't blame you.
I don't blame me either. So she was old. Patients die all the time. We have 30 other patients on our service that require our attention.
You don't mean that. You care that Miss Charlie died. Right?
Of course I care.
Well, you don't act like it.